So welcome everybody. Today's presenter is Dr. Derek Lee, who is joining us from Toronto. He's a chiropractor as a professional, and he's also a great influencer through the social media. Huge followers and a huge education platform, which he's going to introduce us today. So welcome to SSOL, Scoliosis and Spine Online Learning. I'm glad that you're able to join us today.
Thanks very much, Andrea. Happy to be here.
Thank you. And we will answer the questions after, so keep on typing.
Thanks again for coming. Just a little bit more about my background. I am in Toronto, Canada, and I'm going to approach this presentation pretty much from a parent's point of view. Although I'm a chiropractor, my practice is corporate in nature, so I work for large corporations, mainly employee health and wellness, stress management, that type of thing. So scoliosis, I never see in my practice at all. Maybe before 2019, maybe 2 or 3 cases, and I would just refer them out because no clue. So I was pretty much starting from scratch with respect to trying to figure out what's this creature, scoliosis, was all about. And this presentation is all about how I try to bridge the scoliosis information gap just for myself. And I'm hoping to pass that information on to other parents and practitioners as well, because there's such a niche condition that there's so much misinformation. How do you decipher everything? So I thought I'd share today's presentation in terms of how I went about doing that for my son. So this is Jacob down here. He actually did his own YouTube video with Luke Steichleather in Virginia regarding the engineering behind his bracing. So he did this when he was 16 years old. And I thought we'd just go through his attempt and my attempt with him with respect to navigating scoliosis from initial diagnosis. We'll dive deeper into this. Initial diagnosis was 34 degrees, progressed to 53. I had no idea what this was all about, or the timing, or growth spurts, or anything like that. We went into conservative treatment. We braced, even though it was so large already. Once conservative treatment wasn't enough, we had to look at surgical treatment. We had good correction, but I knew it wasn't going to hold, just knew it. And we'll also talk about why I decided to go with vertebral body tethering as opposed to fusion, although both were great options. So let's dive a little bit deeper into the first section here, which is the diagnosis. So I'm going to basically give you an idea of what I knew then and what I know now. So of course, I knew he was 14 years old. Had no idea what Sanders score was. Diagnosis, shock for sure. We had no clue he had scoliosis, and the only way it was picked up was when Jacob had a bit of a chronic cough, a persistent cough. So of course we went to his family doctor, chest x-ray to make sure everything was right, and that's when we picked up the scoliosis. And it's tough with kids. I think boys especially, large t-shirts, a lot of hoodies. We're in Canada, it's cold 3/4 of the year, so they're wearing baggy shirts all the time, or hoodies. So had no clue. And this was a tough time for me too, because I'm a chiropractor, I should have spotted this. So much guilt, and the guilt is universal with parents when their kids have scoliosis, because we blame ourselves for not finding it earlier and dealing with it then. And because, again, I had very little experience with scoliosis, I made my first mistake, and I handed it off to our local healthcare system because, number one, didn't know what to do, and number two, felt guilty. So I said, okay, let the experts handle it. All right. Unfortunately, it took 4 months to get an appointment to see an orthopedic surgeon. And another month after that, to get a brace, and you can see the brace here. This is a modified, I asked them what it was actually, the orthotist, and she said it was a modified Boston brace. So when I looked at this behemoth at the beginning, I went, that's ridiculous. Why am I wearing, why is he going to wear basically a rigid corset? It was symmetrical, you know, scoliosis is an asymmetric issue with the spine. Why isn't it asymmetric brace? There was no padding in here either to even bolster or correct curves. Additionally, the orthopedic surgeon at that time wanted to wait 4 months before an in-brace x-ray. And that's when I started to go, this doesn't make sense. The bracing doesn't make sense. Don't you want to take an in-brace x-ray relatively soon, within 4 weeks maybe, to see if it's actually working, to see what the in-brace correction is like? So I'm thinking, okay, bad brace. Am I wrong to ask these questions? So I started doing more research. And at this point, I just got totally frustrated, and I started to take matters into my own hand. I was, to be honest, it was a blessing in disguise, because I finally got my butt in gear, because I was, again, just handing it off to the experts, right? But now I knew I had to really start to advocate for Jacob, right? And my hope was to avoid surgery, even though I had no clue at that time that if he was in surgical range. I didn't have any clue that bracing tends to be less effective after 40-degree cob handle. So I need to start to research more. Time is precious for sure. Now, what do I know now? This is a slide from Dr. James O. Sanders, looking at curve progression based upon Sanders stage. Here's an interview I did with him on YouTube. You can find it there. And Dr. Sukin Shah, this is his slide actually, in an interview I did with him. And it's really good because it gives you an idea of curve progression in terms of how skeletally mature the child is. So with Jacob, 34 degrees, between 30 and 34 here on the curve size, stage 1 Sanders, and he has pretty well 100% chance of curve progression, and which it did, 53. And he's still young. So at 53 degrees, he's still in stage 1, standard stage 1. It's going to get worse, no doubt. Okay. So I always felt that, again, it took 4 months to get an ortho appointment. If we know this, if we have a good idea of curve progression with this chart in the white cells here, why don't we do a triage for consultations? You know, kids who are pre-growth and within these parameters should be getting seen by a surgeon right away. You shouldn't take 4 months. It should take 4 weeks, maybe at max. Okay. And if you're within the zone, not only should you see the orthopedic surgeon right away, but you should start bracing and physiotherapy scoliosis specific exercises. Okay. Now, for those who not sure what the difference is, European is a little bit more of a Richter scale. Sanders scale, I like to use this chart. So Sanders score in this area. Again, larger chance of progression. 2, 3, 4 Sanders classifications when they're having their greatest speed in terms of growth progression. This is an interview I did with Dr. Aurélien Courvoisier in France, in Grenoble. I really like his slides here and how he manages his patients. With first detection, they tend to screen a little bit more. At first X-ray, they're able to predict, very much similar to that previous chart I had on the previous screen, how much progression is going to be. They try to do the external bracing. If external bracing fails, then they go to non-fusion surgical options if possible, VBT. And if that fails, they go to fusion. So the objective is to try and not fuse if possible. Now, in terms of the external bracing, he starts with nighttime bracing, and I really like how they approach things in terms of even at a 15 and 20 degree curve, especially if there's a family history of scoliosis, they'll do nighttime bracing right away. What I also like is that if the curve progresses a little bit, or if they're starting at a higher carb angle, they'll basically brace out of school. So the idea is to try and improve compliance if possible. So most, especially in North America, you're bracing through school hours, but if you can kind of limit it to out of school where you're not having to deal with body image, bracing in school, perhaps teasing, bullying, that type of thing, then there's higher compliance. And of course, if out of school bracing fails, then you can go to permanent bracing for sure. Okay, you can watch Dr. Crevassier's. I recommend that you take a look at that. I also want to highlight Jacob's lateral x-ray. And you can see he's extremely straight spine. So he's lost all of his sagittal curves. Not only is he thoracic hypokyphosis, he's thoracic lordosis. And you can see them, these very severe reversal in the neck area as well. So I was hoping that we could do something about that, but he was very, very much rigid into flexion. So when he tries to bend in the upper back, there's not much give there at all. So not only are we dealing with severe 53-degree curve, we're dealing with very severe stiff loss of sagittal curves as well. That'll play an impact later as well. So let's move on to conservative treatment. So even though with the previous brace, you can see a link here on the right, we didn't even get a in-brace x-ray, even after 2 months. And even at the beginning, I was going, don't like this brace, so I'm looking for alternatives. So I started to research more options. Looked on Google, there's so much misinformation, contradictory as well. You know, there's tons of cures for scoliosis that are ridiculous. I looked at PubMed, information overload, there's too much. I didn't even know where to start. Then I started jumping into Facebook groups. And it was pretty interesting because I started reading about firsthand accounts of many cases with AIS and treatment options, both surgical and non-surgical. And that's where I found a little bit more information on Luke's type leather down in Virginia. I reached out to Luke, flew down, we did a Rigo Chanel brace. The one thing I liked about this brace, of course, is that because scoliosis is a three-dimensional deformation, it's not a cylindrical, it's not a one-dimensional kind of issue. So you need a three-dimensional brace. I guess that's why Boston Brace is doing 3D braces now as well. Luke, I made the brace for us, but I was also concerned about that thoracic hypokyphosis and how do you brace that? Because oftentimes, if you try and correct the thoracic hypokyphosis, you actually made the curve worse as well. So I had tons of questions. We also met up with Andrea Labelle in Ottawa. She taught us with an intensive two-day program how to do PSSE, Schroth, C's. I wanted to basically, even though I knew that he was in surgical range, I wanted to see if we could try to avoid surgery. This is what all parents want. And we were willing to do that for sure, because I was desperate to try anything except surgery at that point. And I know parents know exactly what I mean. So in order to really give it a go, Jacob did basically 45 minutes of Schroth, PSSE, even Chiro, 7 days a week. And it was brutal. He did that for 9 months. What worked out well is that with Luke's brace, we were able to get correction down to 24-degree Cobb angle, which is a 55% in brace correction. Out of brace x-ray in June from February was 42 degrees. So we had about a 21% curve correction over 4 months doing all these treatments. So that was pretty phenomenal. And I was super encouraged because really you never get that kind of correction with a 53-degree curve. Okay. You can view Luke's and Andrea's YouTube videos here. Actually, Andrea has the largest number of views on my channel at 90,000. This is my homemade ladder in my basement, and that's where we did all of our Schroth exercises. Let's move on to surgical. I knew at this point that we couldn't get any further reduction, and he was still going into his growth spurt. I also, because I treated spine, I knew it was getting stiffer and stiffer as well. And because of the thoracic hypokyphosis, it's so much more complicated. So I knew that the curve wouldn't hold, and he's in the middle of his growth spurt. And so this is with continued Schroth and bracing, it just continued to progress. At this point, I had to admit that in reality that we had brace failure and treatment failure, but don't forget, it was already at 53 degrees. And we gave it a good go, we got good results, but it was time to consider other options, especially moving into a growth spurt. So started researching even more and looking for some kind of treatment consensus. Which is the better option? Is it better option fusion? Is it vertebral body tethering? Is it ApiFix? Is it just wait and see? So I reached out to 5 surgeons, Dr. Amir Sandani, doctor in Philadelphia, Dr. Ron El Hawari in Nova Scotia, Canada, Dr. Ahmed Alani in Turkey, and Dr. Oliveri in New York City. I also reached out to another surgeon as well, and they all do VBT. I wanted to consult with VBT and fusion surgeons, not just fusion surgeons, because I'm looking for options, right? So 4 of the 5 recommended VBT. The 5th recommended fusion from T4 to L4. And I was going, that's a long fusion. And if you go into L4, you're already asking for probably a little bit of trouble with adjacent segment degeneration, with a little bit more rapid disc degeneration and facet degeneration. And I wasn't interested in adding on later on as the decades went by. So diving deeper, looking for whatever the right option is, VBT or fusion. Jump back into Facebook groups, jump back into PubMed, cross-reference surgeons with published research, look for the most recent studies in the best journals, meta-analysis if possible, and again, spoke to more surgeons. The reason I started talking to them was that I wanted to get the most accurate, most recent information, and that was the best way. If I was waiting for research papers or hearsay, even Facebook groups, because there is bias everywhere, right? So started to talk to more and more surgeons, and it was pretty selfish on my part because I started doing these YouTube interviews, long format, because I wanted more information for myself. Like, what was their particular parameters for VBT? What do they feel if the patient was hypokyphotic? If it was stiff, could you get correction in sagittal and coronal plane? I was looking for as much information as possible. And it just so happens that I thought that I'm getting so much great information. Why don't I share it with everyone else? There are 2 purposes to doing the YouTube interviews. By far the most important was getting information for myself, selfishly. But also, this is so invaluable. I could help other parents, I could help other patients when I do it. So we built this YouTube channel, but I would say 2.5 years ago. We have about 3,000 subscribers now with 225,000 views with some of the top surgeons, including my son surgeon, Dr. Amir Sandani. There's well-respected Dr. Peter Newton, Dr. Raj Farangi in Vancouver, BC, Dr. Baron Lohner, even complex spine surgeons like Dr. Selby in Australia as well. So we have about 56 interviews now, about 45 spine surgeons, 4 orthotists, and 5 physios. Doesn't add up to 56 because I interviewed them, some of them twice. And that's how this YouTube channel was born. Decided to go with VBT. And some of the parameters, basically, it's preferable if the curve bends below 30 degrees. He was tethered T5 to L1 as opposed to T4 to L4 fusion. We were able to get almost a 62-degree percent correction in almost 3 years. Usually with the first standing x-ray, that's typically what you end up with, all right? But that's okay. If it's sub 35 degrees, then there's less chance of curve progression, so you don't need fusion. So even though it's not perfect, that's fine. You still have a fully functional spine. Initially with VBT, the curve reverses slightly, all right, over the next few months, then it seems to tighten back. So he had that happen, actually almost 2 years later, it's continued to tighten, but that doesn't always happen. Typically, it's what you get with the first standing x-ray. Now, this is on the right side here. This is my interview, 2 interviews with Dr. Pertrovish in Germany. And this is his algorithm for determining when to fuse and when to tether. And basically, he likes to tether type 1 and type 2 curves, which are basically lumbar curves. He can tether more of a thoracolumbar curve, but if the lowest instrumented vertebra is around L2, he'll do that because it saves and spares lumbar spine. For thoracic curves, he prefers to fuse. Again, you can watch his videos here as well. Now, with the correction, it didn't impact very much at all the sagittal curve. Kind of knew it wouldn't, just because Jacob was so stiff into flexion as well. The next logical step from the YouTube channel, social media-wise, was maybe create my own Facebook group. I had a crazy idea of maybe I should invite some of the surgeons, orthotists, and PTs to become members. It kind of worked out. So I asked actually Dr. Bob Cho, who's chief of surgery at Shriners in Pasadena, if he would basically join my group, and if we could ask him to, share his experience and insight with parents and patients. Didn't think he would say yes, but he did. And Dr. Michelle Wellborn at Portland Shriners, she's also chief of spine surgery there, also agreed. And it just kind of snowballed. So we have these quite excellent spine surgeons who will share their insight in this group. Feel free to join this group if you can, if you already aren't. And super happy. This has been up and running for about, I would say about a year. We have about 1.6 thousand members. Andrea also with a few other physiotherapists in that group. So I think it's building nicely. And this is how I'm trying to educate patients on scoliosis, treatment options, and how to shrink that information gap for parents. The idea is to kind of get them up to speed as soon as possible so they can make decisions in a timely manner. So in retrospect, these are some of the tips I would really like to pass on. If a curve is between 15 and 20 degrees, especially if there's a family history scoliosis and they're headed into growth spurt, brace right away. Don't waste time. If VBT is an option, it's basically much more effective during the growth spurt, right? I know there's ASC or VBT for mature spines. There seems to be some success with that, but on the other hand, VBT was designed for immature spines, and that's where it's the most effective. Don't get discouraged by the first surgeon you consult with, although I was, but it was a blessing in disguise for me because it got me annoyed enough to really get off my butt and take action. Make sure, even though you consult with surgeons, you have a way of contacting them, because I guarantee you're going to have questions you want to follow up, and it's difficult to, especially in Canada anyway, to contact them. Go with the most skilled and most experienced professionals you can find, whether it be orthotists, physiotherapists, chiropractors, of course, orthopedic surgeons. Get your x-rays, MRIs, and reports in order. There are lots of apps or websites that allow you to upload it and share it right away. It really helps with consults around the world. I also jump into different Facebook VBT and fusion groups to get a firsthand experience. There's lots of information, lots of cases, and it's a good way to get up to speed. And in general, from the beginning, try always to plan for the worst. So assume you're going to get a 50-degree curve plus, and then you might need surgery, but you hope for the best. So you go with successful bracing and physiotherapy specific scoliosis exercises. That's the end of the presentation. Happy to take any questions now. But if you like, this is my Facebook group here, YouTube channel, and if you want to contact me, please do.
Thank you very much, Derek. It was a really great overview of not just as a parent going through all the scoliosis journey, but also for professionals to understand what families and parents going through. So if you have any questions, please type it into the Q&A below until your questions arrive. I want to tell you that in Ottawa, where I am, we used to have scoliosis information nights before COVID. And since you built this wonderful YouTube channel, during COVID, we didn't have any option anyways to meet. Every parent, I direct straight to your platform, saving time, saving energy, and going through a faster research project as they have to elect, as all elective treatment, they have to elect the proper ways and pathways for their child. So thank you for putting all that work together. It saves the time and energy for many, many families who will have to go through this process, what you have gone through. And sometimes it takes years. And this way, with your educational YouTube platform and channel, it takes them much, much less time. So a huge thank you from, not just from the clinic clinician, saving us time and energy, but saving the families a huge time for the research. And we have a couple of questions right now on the bottom, asking if most surgeons offer a virtual consultation as long as you have an X-ray and a treatment provide them. Do you think some of the surgeons are willing to meet patients online?
Absolutely. And I think, ironically, COVID kind of accelerated that because it was tougher with the world falling apart, right? It was tough for them to meet up with patients face-to-face as well. So that's why I mentioned that. See if you can upload your MRI reports, your images, your X-ray images onto a web platform. In Canada, there's one called Pocket Health, and you can actually email a link to the surgeons so they can look at it right away, as opposed to in the old days, you had to, mail a CD with the software on it. But that's what actually allowed me to consult with so many other surgeons, because I was able to do that abroad with Dr. Alane in Turkey, Dr. Oliveri in Spain at that time. So totally possible. You just have to reach out to their offices and they can arrange that.
Thank you for your answer and the question. And what is your ultimate suggestion to families who are new to this journey? How to speed up the decision making after, I assume, they've seen all your education on YouTube?
I think the YouTube channel is good and bad. Good and bad in sense there's sometimes too many videos. And to go through it all is, if you go through all those videos, you're going to have a PhD in scoliosis from all these experts. There are shortcuts. If you go on my YouTube channel, in the introductory video, there is a bit of a quick start guide that you can go through and how to educate yourself. At the beginning, I usually recommended Andrea's video. That's why it's so popular, because she goes through a really good summary of scoliosis. There's also another video there by Dr. Sukin Shah, which is an amazing video because he goes through the current treatment consensus for scoliosis. So he'll go through bracing to Schwartz and if surgery is needed. And he does a really, really good job of summarizing what treatment is preferred at a certain time. And that's a really good place to start. if you're looking at one video, that's the one to go with. If you're looking at two, you can look at Andreas too.
Thank you. Thank you. It's an older video, but I guess
It works.
scoliosis is still the same. So I just want to let you know we are following the treatment and the experience your son and in general your research. We do have a question down here on other type of treatments, scolismart, bootcamp, and regarding activity suit and effectiveness. So I'm not sure if you have any research data on that type of treatments as well.
Yeah. I'm happy to talk about that. So scolismart, as a parent at the beginning, again, I was looking for any options, right? And of course, I'm a chiropractor as well, so why not talk to chiropractors that treat scoliosis? And I talked to Scolismart, one of their doctors, and I actually dove. As you can see now, I tend to be a little bit obsessive and persistent. So I went back into the history of how chiropractors treat scoliosis way back, and it was primarily based upon trying to treat posture. It wasn't really based upon how to treat scoliosis, right? And mainly the sagittal curves. But of course, we know now that sagittal curves impact scoliosis for sure. So maybe there's a fix in there. I actually tried a couple of the treatments, but I just knew it was kind of limited in what it could do. And that's why I kind of moved from that type of approach to more of the physiotherapies, because if I was going to do, I want something that had quite a bit more data behind it in terms of physiotherapy, scoliosis-specific exercises, and chiropractic didn't. Nothing was really published in terms of any journals. There's much more with respect to like Scoliosis, that type of thing. And that's why I went with that option. I did do some chiropractic in terms of how treating my son, but unless you do it all the time and you're really comfortable, because I was at that point afraid that I was going to make things worse, right? Because I'm not trained in it. It's only after like 3 years now that I'm pretty comfortable with it, and I know what to stay away from. Biomechanically, I know what I don't want to go for. So I would say that with Scolismart and the activity suit, I think the activity suit is mainly for pain, and have some good results with that. But in terms of boot camps, that type of thing, I'm not too comfortable endorsing that.
Thank you for that. And a couple more questions regarding bracing. How was your son's compliance for the first brace? And maybe you can also add to that why the surgeons are so pessimistic about bracing in general.
I don't think all surgeons are pessimistic about bracing. I think the good surgeons like bracing because the good surgeons read the data and the information, right? And I can see firsthand. And for instance, in one of the slides, I mentioned Dr. Aurélien Courvoisier in Grenoble, Paris, and he loves to brace.
Yes.
And he'll brace at 15 degrees, right? Which no one in North America will really consider, except Walter Ramos there in Virginia, and Luke. But basically, why wouldn't you brace? And the surgeons that don't recommend it don't understand. And I know there's in the literature there's a drop off, of effectiveness after 40 degrees, but why not still try if possible, right? At least you might slow it down a little bit. You're not going to reverse it at that point. In terms of brace compliance, I think Jacob has the temperament where he's very even keel. So it wasn't a problem at all. Although for me it was, because as a parent, when you see your child encased, especially that first brace, it was like, it completely breaks your heart every time, right? But I knew that first brace, he just wore it to give me enough time to try the Rigo Chanot style brace. And his compliance was great. Never complained. Even with doing the 7 days a week, 45 minutes a day of the Schroth exercises, never complained as well. So rare, but at least that was a blessing.
Thank you. And I know there is a paper by University of Alberta researching only the Canadian orthopedic surgeons, and it's an older paper regarding the brace prescription, and it is all over the map. Some doesn't brace, some braces everybody, and there was no real guidelines there at that point. I think if you do the same research now with all the publications and education out there for orthopedic surgeons, more and more are understanding since the brace study anyways, the reason for bracing and the need for bracing. How did you motivate your son to do the exercises daily? Did you supervise him?
Well, first of all, I have to say, Andrea, you are such a drill sergeant. Your exercise. Precision, right? So it was hard for me to replicate that. But what motivated him was basically that I wanted to send him down to work on this by himself because so much time, right? But I basically 7 days a week, 45 minutes a day, I was with him all that time. And as long as I think if we can do it together every day, it shows the parent's commitment and that he's not doing it alone. So I thought that made probably the biggest difference. So of course he hated it after, maybe a month or so, but he did it for 9 months. But you got to do whatever you can. Some parents will bribe the kids, we'll do this. You got to do whatever you can for compliance.
Mm-hmm, mm-hmm. All right, so we have a couple questions. So let's just summarize this. In terms of an adult condition, during your interviews, which surgeon would you suggest might be comfortable if somebody wants to ask a question to approach?
Sure. Well, there are many, but to be honest, I focus more on pediatric surgeons just because of my son's journey, right? It's now that I'm beginning to talk more to adult surgeons. I would suggest just maybe signing up to my Facebook group because we have adult spine surgeons who are on there as well. Dr. Baron Lahner, Dr. Mike Selby. They're also complex. Dr. Mike Selby is from Australia. He talks to patients on the site, and he's a complex spine surgeon as well. So he's one of those weird surgeons who really likes difficult cases. I don't understand it. I guess I do and I don't, but and it depends on the country you're going to. If you're Europe, there's Dr. Trovish, Turkey, Dr. Alanai. So there's lots.
Thank you. And regarding the x-rays, it is standard practice to take not just the frontal or PA x-ray, but the lateral x-ray. So if your doctor hasn't ordered that, please contact your doctor. And of course, the EOS imaging or normal x-ray is whatever is available in your area. I know in Toronto, you have EOS imaging in a hospital, but not necessarily everybody who has scoliosis could go there other than if you're a child. So you don't have any options as an adult as normal x-rays, I believe. So could you share the information on recovery on the VBT after the VBT surgery?
Right. So we were lucky again with Jacob. After post-surgery, they have the kids walking, I would say less than 24 hours after surgery. So they're up and about. They start doing laps. They do have a chest tube with VBT because the approach is through the side of the ribs, in between the ribs. His pain level through the process was about 1 out of 10. So that particular, he had a surgery done with Dr. Amir Samdani in Philadelphia. So they do tons of it. So they know it's like it's like a factory, everyone's trained, they know what to expect. We were home in about 4 or 5 days. The hardest part about the whole treatment was the trip home, because it was a long drive. We should have split it into a couple of days, but we did it in one shot because we kind of wanted to get home. But if I was going to do it again, we would probably stay another day and then broke it up. Mm-hmm. But recovery is pretty quick.
And how was after VBT, any exercises were done, or how was his activity?
Mm-hmm. At that point, there was not a lot of information on how to do exercises post tethering, right? Should we go more towards Schroth, because he does have a 20-25 degree curve? Should we do that, or should we not do any physiotherapy? So I'm a strong proponent of that. He should be doing some kind of exercises afterwards for sure. So we try to get him as active as possible. But it was tough at that time as well, because that was part of the lockdown, 2019. So ironically, it was just before everything got locked down. So it's December 2019, then we went into 2020, and that's when so things were a little bit more difficult at that time, but I would definitely recommend follow-up physio after that, even for fusion, right?
Thank you. And do you have a checklist or a recommendation list for parents who are told to wait and see? What type of questions should they ask, or how could they approach the orthopedic surgeon if they have a different idea on the wait and see approach?
For sure. Once you go to the Facebook group, we have guides there that members can download. But for sure, you want to talk to I know sometimes it's hard to even get one consult, but that's why these virtual consults are pretty handy. Even if you don't go with a particular surgeon, you're getting more information, right? And the interviews are really helpful as well. Because not only does it tell you what that particular surgeon, their approach is, but you also look at their personality. Because oftentimes, even when you go to a hospital to see a specialist, a surgeon, you only have to with them for like 10 minutes, right? And you're probably going to forget 80% of what was said. Okay, so with these interviews, you spend an hour with the surgeon, you see how they think, right? How conservative they are, how aggressive they are. And it's a good way of actually shopping, I found, to be honest, right? Who would you pick? So that's a good way if they do interviews. That's the way that I would approach it for sure.
Thank you. And what is your approach for the sagittal plane? What do you see in terms of a treatment or effectiveness to improve your son's sagittal profile?
Yeah, that's a good question. With him, it's pretty well impossible, just because he's stiff into flexion, so he's not. I wish he could slouch. Let's put it that way. All the kids these days are totally kyphotic, right? He can't, but I wish he was. Just because he's rigid and stiff. That's why what I know now, I think it's a toss-up between VBT and posterior spinal fusion, right? Because with the posterior spinal fusion, you can improve the sagittal curve, so he's more into kyphosis, which will also improve his neck kyphosis as well. Because with scoliosis, most patients will have issues L4 or 5, L5S1, and in the cervical spine with disc degeneration earlier than a normal spine for sure. So, but I was told I should have talked to more of the surgeons about fusion, right? That's something I should have done before, because the one I saw recommended T4 to L4, and I was going, I don't think so. But if it's just L2, right, T4 to L2, that's a really good option as well when I look back on it, because you can improve his kyphosis. Now, if the person has a flexible thoracic spine, right, then they can definitely work with trying to improve flexibility, and you can also try to improve that with bracing if they're flexible as well. So a lot more options if the kyphosis or the thoracic flat back is flexible, and I would definitely pursue that. But in my son's case, not possible, unfortunately.
Well, thank you for that view, because unfortunately, with the flat back condition, or the older fusions, when they didn't correct the sagittal profile, the issues are the same above and below the curve, the kyphosation. So it is really important to look at the sagittal profile deeper and deeper, and to have the treatment for it. I mean, some sort of exercise might help to save the compensations below and above, even though the main curve may not change because of the shape of the vertebra, right? The raso and all that. Did you look at the extremities of your son? There's a question here. Did you find any reason to believe that the legs have any connection to the scoliosis?
I didn't. What's interesting is he didn't have any leg length discrepancy or anything like that. Even if you look at his x-rays, he's always quite level, so that wasn't a concern. But what's kind of interesting, and I'll be doing a future webinar on this, is there seems to be a correlation between transitional vertebrae and scoliosis. And for instance, if you might have at the cervical ribs, you might have at C7 cervical rib, you might have at L1 ribs as well, and you might have transitional vertebra at L5 to S1. So you might have like one side of the vertebra is fused, or you might have an accessory joint. It seems the research is indicating that 20% of scoliosis cases have at least one of those. What's really funny, but not funny, is that Jacob has all three of them.
Yes.
So you have cervical ribs, a lumbar ribs, and transitional vertebra. So it'll be interesting to see what future research says with that in terms of how that, because it can't help but impact the sagittal curves, right? And that I'm more interested in than a leg length discrepancy right now, and how that bodes for the future.
Yes, and I believe we had just recently a very important webinar as well. It's in a library, stating that even though we call idiopathic scoliosis most of these cases, unfortunately, if there is a cause, if there is some growth failure we could find, then it may not be idiopathic, but you can check in a library for more detail. Well, I wanted to thank you very much for taking the time, and hope everybody will visit the YouTube channel and learn more about from all the videos and all the interviews you conducted. So thank you so much for all that work you have put in, not just presenting today. And I know it wasn't your favorite hour or two, hour for sure, but it's very important for us professionals and families to understand the full scoliosis journey of the families, and how to navigate through that and a maze of information which is coming towards us and towards the families from research and publications and internet. It's a lot.
Absolutely. Thanks for inviting me again, Andrea. And I had fun. It wasn't as nerve-wracking as I thought it would be.
I hope so. We try to make it very, very friendly.
I'm used to interviewing, not presenting, so it's just different.
And lots of thank yous in the comment here. Bye-bye.
Bye-bye.